My name is Jessica Powell, and I will be performing a hanging of a piggyback to a primary line. I go to FSCJ, and I'm in FSCJ's nursing program. I'm in term 2, and I'm in section 5. So first what I would do is I would be looking at the MAR. I would look at the doctor's orders, and I see that the doctor has ordered Flagyl via IV 500 milligrams every 6 hours. The action of this medication is bactericidal. The purpose is it's used to kill anaerobic bacteria from an infection. The recommended dose is 500 milligrams every 6 hours. Side effects are superinfection, dizziness, headache, and aseptic meningitis. Contraindications would be hypersensitivity, first trimester of pregnancy, and severe hepatic impairment. Nursing implications would be to obtain specimens for CNS before initiating therapy, monitor eyes and nose, and assess IV site for phlebitis, rash, and infiltration. I would also monitor the correct labs, so I see that I'm using this as an antibiotic. The patient's white blood cell count is elevated. And I have already calculated my flow rate, and it would be 100 milliliters over 60 minutes, and the drop factor on my tubing is 10, so that would be about 17 drops per minute. So I'm going to take my Flagyl, and I'm going to look and see if that it's not expired. I see that it's not expired, and I'm going to draw up half a milliliter of Flagyl to put in my piggyback bag.
And then on the previous video, I didn't do this, but
And I'm going to put my initials, okay?
is we need to
Put date and
put
time,
the sticker
okay?
on the tube. Okay, this lets us know which day we need to change it.
And also what I'm going to do is I'm going to rewind the screen, okay? Because that lets them know where it needs to change.
And then of course I'm gonna
So I'm
lock
going
this in
to
place and bring all
my
of my
initials
materials to
and
the
date, okay?
patient's room.
Okay, so then I'm going to take my bag, and I'm going to insert the medication into my bag.
This is Nurse Walt again. How you feeling? Hey, I got another order from the doctor for another antibiotic. Okay.
But first, I'm going to discard this into my sharps container. First, I would have cleaned the port before inserting the medication. And I'm going to apply a label onto my bag with the client's name, the drug, the route, the timing, and my initials. And I'm going to take my tubing in my bag. I'm going to attach the needleless device. I'm going to make sure that it is clamped off.
Minimally invasive to you. All right, sound like a plan?
Attach the needleless device to my bag. I'm also going to put a label on my tubing with the time, date, initials as well.
Looking and feeling good. And I'm going to inspect the IV site.
I'm going to prime the
I
tubing
don't see any rash. I don't see any redness or
to
swelling.
ensure that there is no
Are you feeling okay? Are you
air.
nauseated?
There's no air.
Do you feel
And now I'm ready to
dizzy?
go into my patient's room.
Okay.
I'll
Is there
take all of
any
my
pain?
supplies, knock, perform hand hygiene. I'm going to introduce myself and identify the patient with 2 forms of identification and explain what I'm doing. And I'm going to reassess for any allergy history and see that the patient has no allergies. So I'm going to assess the IV site, and I'm going to be looking for any phlebitis, pain, tenderness on palpation, pain, edema, and I see that there is none of that. So then I'm going to put on my gloves.
There you go. Okay, so now I've filled my chamber here, and I can go ahead and actually prime my line.
I'm going to clamp off my primary tubing that is already here. I'm going to hang.
Line is primed.
Okay, now normally,
Okay. Now, prior to doing any insertion of anything,
Hang my tubing
light going with an alcohol light.
and lowering the primary tubing.
Okay. Since this tubing just came out of its package, I know that it's sterile and I still have this protected. So one of the nice things about this is I'm not having to do
Then I'm going to take an
flushing
alcohol
because I
swab
know this is already done. So
and clean the
in
port
this case,
of the primary tubing and attach
taking the time line
piggyback tubing.
and I will connect. Now a couple of things I'm going to be looking for is I'm going to be looking to see if there's any sedimentation. If any sedimentation starts
And I'm going to
as soon
unclamp
as
it.
put in the
I'm going to
IV,
establish the flow rate, which is
then
17 drops per
I'm
minute.
going to immediately stop the entire IV. At
And
the
then
place
after
closest to
the medication has been administered,
patient,
I would leave. I would
I'm going to disconnect the tube.
gather up all my supplies, throw it away, and then I'm going to come back and I'm going to see that the medication is done.
Any
And
situation
before I would leave though, I would observe for any signs of medication reaction, infiltration of the IV site. I'm going to come back, reassess after the medication is complete, reassess the patient's IV site, make sure no infiltration, phlebitis, any reactions to the medication. And I'm going to clamp off
Is this going to
my
be
piggyback tubing.
proper dose? What's going to happen is this is going to empty, and then this one
So what I'm
continue
gonna do
at the
the
gate
purposes,
close.
this is ready for the next
And
Okay?
then unclamp my primary tubing and reestablish the flow rate for the primary.
I can start adjusting my
And then I'm going to remove the piggyback from the primary and put an alligator clamp on it
and
make sure that I don't have
it's flowing beautifully.
to retain for a later administration.
medications to wait.
Okay, Ms. Pinter, are you feeling okay?
And again, I'm going to observe the site
I don't see any rash.
for any infiltration of phlebitis and medication reaction to the primary line. And I'm going to remove my
I
gloves,
also don't see any
Since I was already doing it.
redness.
take out any supplies that I had, throw it away, and I'm going to document the medication that I use, the time, the drug, the dose, and the route, the condition of the IV site, the volume of fluid used to deliver the medication, and the I's and O's.
And
There
I
are
would
certain
use back
things
to
that
how
I do
they
need to
tolerate
check
it.
for